started. If you have any questions at the end, we'll leave time for questions at the end of the slides. I just ask that you use the Q&A tab at the bottom, right in the middle there. We'll be able to see your questions a little bit easier that way, as opposed to the chat tab. So today we're going to talk about low-level laser therapy as a treatment for female hair loss. And I'm just going to get my slides going here. So if you guys have been tuning in the past few Wednesdays, I think this is the 6th webinar I've done. I've been doing them every Wednesday for the past month or so. We are going to continue these because we've had some pretty good feedback. The next one is going to be March 18th. I'm not entirely sure of the topic yet, but if you have topics that you want us to address, continue to email them to us. All of the feedback has been great. If you have questions that we're unable to answer today, we're happy to answer them via email if we need to look some things up for you. So this is the agenda for today. We're going to talk about the background on female hair loss, which we've reviewed before, so I'll go quickly over that. We'll talk about the history of laser therapy. So LLLT stands for low level light therapy. So LLLT is going to be the abbreviation. We'll talk about how it works, the products that are available today, because there's a lot of products out there, and then a comparison of the devices at the very end. Again, there'll be time for questions at the very end, and I ask again that you just use the Q&A tab. It's easier for us to see them that way. So this is just a quick bio of me if you haven't watched the webinars. I've been a nurse practitioner for about 5 years. I've been a nurse for over 10 years. Spent a lot of time in the ICU as a nurse and then transitioned over to medical aesthetics. I've been doing injectables and PRP for about 5 years now for hair restoration. So this is an office update. Our offices are all open. So we do have, you know, enhanced safety protocols in place. We have, you know, a specific number that we limit the number of patients that we see per day. We space everyone out, so there's very minimal foot traffic. We screen all the staff and patients every day. Everyone wears masks at all times. We have plenty of time also between appointments that we sanitize each room, and we also have air purifiers in each room. So we are still available by phone and video appointment. If you're still not comfortable coming in, completely understandable. You know, we want you though to make sure that you continue your treatments, taking advantage of these video appointments. You know, we just want to encourage you to continue treating anything that we started. We are able to ship products if you don't want to come in and purchase any. We also have our online store so that you continue to get your products when you run out of them. So we are going to talk about female hair loss. We've talked about this numerous times. You guys have seen this slide before for sure, so I'll go over it pretty quickly. So this is a diagram of the hair life cycle and types of hair loss. So there's 3 phases to the normal hair life cycle. The first is called the anagen phase. This is known as the growth phase, and this can last anywhere from 2 to 6 years. In this phase, your hair is receiving all the nutrients it needs. The hair is actively growing, and one of our treatment goals is to prolong this phase. The second phase is called the catagen phase. So you'll see that as number 2 there in the diagram. This is known as the transition phase. This lasts anywhere from 2 to 3 weeks. No further growth is happening at this stage. And then the telogen phase, this is known as the resting phase. This can last anywhere from 3 to 4 months. This is the actual shedding phase, and then a new hair should grow in behind that. Over time, because of genetics, it's possible for the entire hair life cycle to shorten. And these are just a breakdown of the different types of hair loss in women. So our non-scarring alopecias under that umbrella are androgenic alopecia, which is also known as female pattern hair loss. That's the inherited form of hair loss. It's the most common as well. Telogen effluvium is the excessive shedding without a lot of regrowth. I did a webinar last week on telogen effluvium specifically, so we talked a lot about that. Traction alopecia, and then alopecia areata. Traction alopecia is from, you know, tight hairstyling, braids, tight ponytails, things like that. Alopecia areata are spotty bald spots that can come and go. They kind of wax and wane. And then the post-cancer hair loss we see frequently as well. So that's all under the umbrella of non-scarring alopecias. For scarring alopecias, they're a little bit more difficult to treat. You know, the hair follicle actually gets damaged in these situations. So under that umbrella is frontal fibrosing alopecia, CCCA, and LPP. And the time frame that the hair follicle, you know, in general in this anagen to telogen phase, the time that each hair stays in these phases will determine how much shedding is occurring and really how much regrowth we're able to achieve as well. So treating female hair loss, the big thing is to get you in the office to actually determine the cause of what's going on. So the treatments vary greatly from diagnosis. The number one thing we want to find out is your medical history, your hair loss history, do a physical exam. We then do what's called a trichoscopy. It's a magnifying device where we actually look at your hair follicles under a microscope. This is really to make sure that, you know, there's nothing different or strange going on with your scalp, not anything that we consider needing to do a biopsy for. So the biopsy is rare, but we have been doing biopsies here in the office. It's a quick procedure. We do them here actually seemingly more frequently recently, but it's something that we can just officially determine what the cause is if we're unsure. And then oftentimes we'll either order blood work or have you bring us a copy of your blood work from the past year to make sure that you're nutritionally in good shape, if there's any underlying deficiencies that we want to target. And, you know, like I had mentioned, the treatment plan can really vary greatly depending on which type of hair loss you have or whatever the underlying diagnosis is. So we are going to talk about low-level laser therapy. This is what our kind of breakdown of the agenda will be. Again, so it'll be a laser overview, what you want to look for in laser devices. We'll talk about what we carry here in the office, known as laser cap. We'll talk about hair max, we also carry as well, continuous light devices, and then a comparison between these. This is a little history of low-level laser therapy. So photobiomodulation is also known as low-level laser therapy. It was discovered in the 1960s by Andre Meester. He was working in a university in Hungary. He was trying to repeat an experiment that was first conducted in Boston, who had actually used the newly discovered ruby laser to cure malignant tumors in rats. Meester's laser had only a small fraction of the power, so he was not able to actually cure the malignant tumors. But he did observe a heightened rate of hair growth and better wound healing in the rats. So he had actually surgically implanted tumors in these rats with this lower powered laser. So for many years, laser therapy was used for wound healing, reducing pain and inflammation, but in the last 15 years, it's been more commonly used in treating hair loss. So how does low-level laser therapy work? The laser stimulates hair follicles in your cells to grow, and the scalp increases cellular activity around the follicle. So this actually increases blood flow to these follicles, increasing circulation, decreases inflammation, so that these hairs can really grow thicker and stronger. If you see here in the diagram, it has a picture of the before, so your follicles are pretty inactive, they're growing slowly, they're producing those thin miniaturized hairs. During the laser therapy, the second picture there, the laser light is absorbed by the cells of the hair follicle, which provides energy that enhances cellular respiration and hair growth. And then after is those, you know, you'll see some of those dormant follicles, they'll be kind of woken up from their inactive state and produce thicker, healthier hair. So when the scalp's illuminated by red laser, light energy is absorbed by stem cells in the dermal papilla. This is a specialized region of the follicle near its base. These cells, they play a central role in controlling the hair cycle and promoting the hair growth. So these are energized when they absorb the red laser light. Their ability to perform cellular respiration is enhanced and their activity is increased. This is just a continuation on here. So Low-level laser therapy, it's been proven to not only thicken those existing hairs, but also increases the number of hairs in that growth phase or that anagen phase that I just talked about. It's super safe. It's not associated with any real serious side effects. It's really the only recommended hair treatment option for pregnant women, so it's super safe, and it works by slowing in some cases and then reversing miniaturization, particularly with female pattern hair loss. So there were really two major studies that were done in 2014 that really solidified the effectiveness of the laser therapy. So with anything, we here love research and finding what works and what doesn't. So we found these two articles that really prove the effectiveness of the laser. This is from the Journal of Trichology, the use of low-level laser therapy alone or with use for both with use in some other hair treatments, both for male and female androgenic alopecia. And the results showed that about 88% of the participants in the study had improvement, whether that be slowing of the progression of hair, thickening of those miniaturized hairs, or actual regrowth. 63% of them had moderate improvement, and about 25% had significant improvement. The demonstrated improvement in patients who were already using the 5% minoxidil solution, so they were using like a combined therapy, showed significant improvement when those were using the minoxidil as well. So this further kind of proves the importance of combination therapy. The more things you do for your hair, the better results you're going to have. There were no significant side effects in this study, it again had about 88% of participants did have improvement in these three-mentioned things. So progression of hair loss slowed, thickening of miniaturized hairs, and actual regrowth. Another study that we found is from the Journal of Clinical Dermatology. This talked about, again, the low-level laser device in female pattern hair loss, both in male and women. So that's the androgenic alopecia, the inherited genetic type of alopecia. This was a double-blind study, so that's really the gold standard of studies. And what the results showed were that there were significant increases in thickness, hair counts, and then the sham device users claimed to have saw a new decrease in density. There were no significant side effects. So clearly, people using the actual treatment, the actual laser, saw significant improvement. So who can benefit from the low-level laser therapy? It can be beneficial in the treatment of the following types of hair loss. So androgenic alopecia, which is female pattern hair loss. This helps to reverse the miniaturization and prolong the growth phase. So what happens with female pattern hair loss is the hairs don't grow in as thick and strong as they once used to. So this will help to prolong the growth phase. It's good for traction alopecia in anyone who has used tight hairstyling, box braids, tight ponytails. Again, this can cause miniaturization and actually pull the hair from the actual follicle. So the laser will help to, again, reverse miniaturization and prolong the growth phase there as well. And then telogen effluvium, so it does help prolong the growth phase as well in telogen effluvium, which is an increase in shedding. It takes a while. It takes anywhere from 6 months to a year to see the regrowth after a telogen effluvium, but this, the laser has proven to help speed that up. In some cases, the laser therapy can be beneficial for scarring alopecias or alopecia areata. It's been found to decrease inflammation for those cases. If there are any history of skin cancer to the head or face, the laser is contraindicated, but that's really the only contraindication for the laser. So what to look for in a laser device? There have been numerous studies, including multi-site double-blind studies that we just talked about. But based on these studies, we look for the following in our devices. So what's important is pulse light therapy instead of continuous light. So short repetitive light pulses allow for, higher intensity outputs without excessive generation of heat. So the more these are pulsing off and on, the less likely that the lights are more, less likely that they'd be to burn out and cause, you're going to get the same amount of energy at the start of the treatment than you would at the end. The new fad in laser devices is continuous light that you use every day for 5 to 6 minutes, but a lot of studies have proven that pulsing the lights improve the laser outcome. So like I said, with those continuous devices, it's those lights can die out pretty quickly. One big thing is using laser diodes instead of LED lights. So the LED lights have not proven to be as effective in studies compared to the laser diodes. So that's the cool beam laser, and that's what we have here in the office. And I'll show you guys that in a little bit. And anything with 650 nanometers in wavelength. So the pulse light therapy is really the big thing here. You know, the amount of energy, like I said, is the same throughout the start of the treatment than it is at the end. It gives a little bit of time for those lights to rest. And the other thing, the other kind of takeaway is the laser diodes are better, proven to work better over the LED lights, which are that cool beam laser. So the laser cap companies, the original laser cap device was developed over 10 years ago. Laser cap is what we carry here in the office. There's 2 different size caps, 304 diodes and 224 diodes. The 304 is the newest one. This is the FDA cleared approved treatment for female hair loss. The pros, like I had mentioned, there's higher energy dose per treatment with that pulse light therapy, higher peak intensity. You get a more consistent output for the entire treatment area. It's hands-free. There's an improved device durability and longevity, and then the limited lifetime warranty. So with the laser cap company itself, it's great because they offer a 12-month money-back guarantee, so if you were to purchase a laser cap, we would do photos at 6 months and at a year. And if after the 12 months, you don't feel like your laser cap has shown improvement for you, you can return it for a 25% restocking fee. We really don't have many people returning these laser caps. Pretty much everyone is seeing some type of an improvement, whether that be slowing the progression of hair loss, thickening those miniaturized hairs, and actual regrowth. The company itself, they're absolutely great to work with. If anything happens to your laser cap in the first 3 years, they will repair or replace it for free. After 3 years, there's a $500 deductible, but that has that lifetime warranty. They'll repair it or replace it for life for $500 after that. The cons are that there's initial higher price. So the laser cap, the 300, 304 flex is essentially, it's $3,000. The 224 is $2,500. The laser cap itself, I'm going to show you guys what it looks like. So it looks like this. It's just a cap with a little cord here. It fits on your head, super simple, just like this. It clips into the battery pack here, and then it just can clip onto your pants. What you want to do is wear this for 30 minutes a day, 3 times a week. So it's a pretty easy at-home treatment to do. You really, there's no mess involved. It's something you can do before bed, watching TV. It's portable, so you can use it while driving. It comes with a great travel case if you need to travel. So it's really the best laser cap out there that you can get, the best one on the market that we have found. This is our other product or laser that we offer here in the office. So the Hair Max laser band, it's the original laser therapy studies were performed from this with the Hair Max laser comb. The device has a laser band that has 82 and 41 diodes, and then the comb that has 12 and 9 diodes. It's also FDA cleared for treatment of female pattern hair loss. The pros are that the quality devices, it's still a good quality device, and it's a lower price point. The laser band, I want to say, is around $800. The cons are that you have to move the device around to different treatment areas. I don't know if I have a laser band in the office, but basically in the room here, I don't know if you, with the laser band, you have to hold it and move it. So it's a little bit more work in that sense. You want to use it 10 minutes, 10 minutes, 10 minutes to kind of get all of those areas. So that's one of the cons. You can't just leave it there and kind of go about whatever you're doing. It's not guaranteed for optimal energy in all areas, meaning, the light doesn't pulse off and on as the laser cap does. It has a shorter warranty and money back guarantee. So the laser band only gives you a 5-month money back guarantee, and in comparison with the laser cap, which is 12 months. Any treatment for hair, you really need to give it a good 6 to 12 months to see the results. So like I said, the laser cap has a much better lifetime warranty over the laser band. Other devices that are out there, if you're looking up online, anything cheaper, there's a lot of devices on the market now. The most well-known ones are the Capitalist, the iRestore, Thermodrome, and iGrow. These have anywhere from 40 to 312 red lights and laser diodes. So the effectiveness is a little bit less because they don't just use laser diodes. We recommend focusing on devices that only include the laser diodes instead of the red light and produce at least 4 joules per centimeter squared of energy output. This is what this research has proven to be most effective. Often, the big thing is people see these and they're cheaper, so it's more desirable from that sense, but they often don't meet the expectations of people that were found in clinical studies and that we see here in the office too. We actually do a lot of buyback of a lot of these laser bands that will allow you to put towards a laser cap. Many companies are moving and have moved to continuous light devices that supposedly require shorter treatment times, but we haven't seen research to back this up. So while using the laser cap for 30 minutes might sound like a lot for you, the 10-minute therapy is probably not going to be enough, especially because these continuous lights are just dying out a lot faster. This is a comparison of the laser cap, HairMax, Capitalist, Thermodrome, iRestore, and the iGrow. So laser cap is the only prescription laser that's out there. So you can't buy the laser cap, the Laser Flex 300 online. You have to buy it through a licensed medical office or physician's office. So you have to make sure that you're prescribing it essentially to the right patient, someone who has female pattern hair loss. Laser cap themselves, they don't want people to use it if it's not going to work for them. So that's why they make you really go through a screening with a medical professional who specializes in hair loss before you can purchase it. It has the optimal energy option. It has diodes 224 or 304, laser diodes. It has full coverage of the scalp, as you saw. It fits, it covers temples, crown, front. It really gives you the most surface coverage. It's very discreet, meaning you can put a cap over it if you're driving. The con of it is the price. Like I mentioned, it's expensive. But this is our this is what we strongly recommend. This is the #1 thing that we found on the market. The next is the HairMax band. This is not a prescription you can purchase elsewhere. It doesn't really provide optimal energy. Like I had mentioned, it doesn't turn on, the lights don't pulse off and on. So occasionally those lights can get hot or burnt out. It has 41 to 82 laser diodes. Doesn't provide full coverage, so you really have to move that band around. It's not hands-free, not discreet, but the pro of it is that it is more affordable in price. So this one is better for people maybe with traction alopecia here at the frontal hairline that really want to target this area specifically. And then you can kind of scroll through here and see the Capitalist. It's not a prescription. Thermodome, not a prescription. Neither is iRestore, iGrow. If you just go through, you can kind of see where laser cap just is the superior product here over any of the rest. So combination therapy, the more you do to your hair in terms of treating hair loss, the better result you're going to have. So we are very, adamant that if you're able to combine treatments in multiple different ways, you're going to have the better results. We use the laser therapy often with OPC or PRP, which is the injection platelets into your scalp, the areas that you're losing your hair, with vitamins and supplements, and with minoxidil. Studies have shown the importance of combining these therapies. I think I had mentioned before, there was a study in 2017 that combined lasers and minoxidil. And the group that used both minoxidil and low-level laser therapy had significant outcomes compared to the groups that just used the laser therapy or just used minoxidil. All right, so we have some time here for questions. I'm going to just open these up and take a look. There's one question here: can low-level laser therapy maintain hair growth permanently? So The thing is consistency with key with the laser, with any treatment really. So you want to make sure, there's also a question here, do you use this for the rest of your life? So kind of those go along together a little bit. Yes, as long as any of these hair treatments are essentially things you need to do for life, but you need to be consistent in doing them, meaning using the laser cap 3 times a week. You can't use it for a couple years and expect that to kind of stay the same as it did when you were using the laser cap. So you need to think of hair loss as a progressive condition. You know, it will get worse without treatment, depending on the type of hair loss. So it really just depends on what's going on. But anything, you know, with hair, it's consistency and treatment is key. So someone here is asking, since I've had skin cancer on my face, I shouldn't use laser therapy. Why? The reason behind that is that, you know, this can cause regeneration of cells. So we wouldn't want to regenerate any of those cancer cells and, you know, potentially provoke it to come back. So it's just a safety measure. It's unlikely, but it's just a contraindication to any laser therapy because it can regenerate those cells. There's a question here. I used the eye restore for a year and it didn't work to grow my hair. Now I use it less every other day or so. So I haven't used it in a week though. What do you think? My hair is missing on the scalp area and I have a few pimples, which I have to go see the doctor. So this person had asked if I can answer this over email, which we will. It sounds like it's a little bit more specific. So I apologize, but we will get back to you about that. So if you travel for 7 days away from home, do you need to bring the laser cap with you? Yes, if you're going away for longer than a long weekend, we suggest bringing it with you. You know, if you miss a couple days here and there, it's not going to kind of be detrimental to your, you know, use of, you know, the time you've used it. We do provide you with a travel case when you purchase a laser cap. So it's super safe. It's a metal case that's easy to travel with. So yes, you would want to bring it if you're going away for 7 days. How long does a cap last for? Longevity of the product? That's a good question. So the laser cap company themselves, like I had mentioned, they'll give you a lifetime warranty. So the company, if anything happens to this in the first 3 years, they'll repair or replace it for free. After that, they'll repair or replace any damage or problems with it for $500 after that 3 years, but that warranty is for life. So you will have that product for life and they will fix it for you for life. So somebody asked, can laser help those hair follicles that are dead, dormant, or does it help only with those miniaturized hairs? Can it help you tell the difference and can you tell the difference microscopically? Yeah, so when we do your evaluation and we look at you under the trichoscopy machine, that microscope, we can see miniaturized hairs versus dormant hair follicles, and the laser helps with both. So the laser is going to help the longevity of those miniaturized hairs, so it will hang in the follicle longer and grow thicker and longer. And the laser also helps to increase blood flow to those follicles. So if there are any dormant follicles, potentially can help to regrow hair there. There's a question, is there a better time of day to use this cap? No, whenever that 30 minutes is, you know, best for your schedule, that's when you should use the cap. A lot of people like to do it at nighttime. You know, a lot of people have nighttime skin routines, other routines, brushing teeth, kind of wind it down, watch TV, read a book before bed. Oftentimes, most people we know use it at nighttime. There's a question, is the pulsing light preferred for treatment of the scalp or for maintaining the cap itself? So maintaining the cap itself. So the pulse light therapy helps to, well, actually both. The pulse light therapy is going to help to maintain the diodes longer. You know, those lights aren't going to burn out. And also the pulse light therapy kind of gives you a peak effectiveness over continuous light therapy. So there's a question, on the days I'm using laser therapy, would I have to do the minoxidil treatment that night also? Yeah, so we would recommend doing the minoxidil as well as doing the laser cap. So minoxidil should be used every night, where the laser cap should be used every other night or 3 times a week. Is there anyone in the cap that it's not recommended for? The cap is not recommended if you've had any skin cancers to your face or scalp. Yeah, so there's a question. I have an old greater than 7 years hair max band. It pulses every 2 minutes, maybe to change position. Did I hear you say that it should be left in one spot for 10 minutes? Yes, so what you should do is hold it here for 10 minutes, 10 minutes, and 10 minutes. It does pulse to remind you to move it, but you want to hold it there for 10 minutes, 10 minutes, and 10 minutes. So it's still going to be a matter of a 30-minute treatment, similar to the cap. There's a question here, when the cap does, when using the cap, does your hair and scalp need to be clean of all styling products and Rogaine? You know, the cleaner the scalp, the better. The other thing too, with the scalp and the minoxidil, it's better to use the laser and then apply minoxidil after. You know, it's better to be used in a clean environment, but if you have products in here, you certainly don't need to wash it before. You're using it every other day anyway, so it's going to target those hair follicles. Question here, what happens if you drop the laser cap? Well, hopefully nothing, but if you do and something breaks, like I said, there is a warranty on the product. For the first 3 years, they repair, replace it for free. After the 3 years, they do provide you with a full lifetime warranty with a $500 deductible. I did just want to mention with the, you know, with someone who's questioning contraindications, you know, if you really are interested in doing the laser, but you don't know if it's right for you, you know, seeing a specialist is super important. So coming in here to see us and evaluate you to determine whether or not it's safe or right for you is your number one best option. So there's a question, do I use minoxidil 1 or 2 times a day with the laser hat? Use the minoxidil once a day, as depending. So if you're using minoxidil 5%, it's once a day. If you're using 2%, it's twice a day. If you are being treated, can one have a permanent or have their hair colored? You can color your hair and use the laser cap. Is there a benefit to using it longer than 30 minutes for 3 times a week? There has been no research to prove that it's better for you to use more than 30 minutes for more than 3 times a week. No. We recommend at the very most using it every other day, and there is no research supporting that it's better to use more frequently. Someone asked if it helps to have your scalp clean. I think I had already answered that. Better to have a clean scalp if possible. You want to make sure your hair is dry when you use it, but otherwise is fine. Are the Hair Max combs at all helpful? I think any laser is helpful, but there are superior products over others, that being either the laser band or the laser cap. And that's just because these products have the, you know, the recommended things that I talked about, pulse light therapy, certain number of diodes, higher coverage area. The hairband, Hair Max hairband, how many times a week should it be used? Same thing, 3 times a week for 30 minutes. There's a question here, do you feel any heat with the laser therapy? You should not, especially with the laser cap. It's cold beam light therapy, so that should not cause any heat. There's a lot of questions here. A lot of them are pretty specific that we can get back to you with. You know, there's some of people that have purchased products through us and had some questions, or actual lasers through us had some questions. Timing of treatment, certain effectiveness of other lasers that I'm not personally all that familiar with. And then some questions about pregnancy. So those we can get to via email, and we'll get back to you. And then there's question here. There isn't a strap on the laser cap, and I was wondering if there's a way to keep it on while doing chores around the house. No, there's no strap on the laser cap. It does come with a hat that you can place over the laser cap, so it gives you a little more support, but you shouldn't be like bending over with it on. You don't want it to fall off. Really, it should be used kind of like relaxing, watching TV, not really moving around, or driving is fine if you're sitting down. There's a question, can I use mousse after washing your hair? I wash my hair every 3 days. Yeah, mousse is fine. I would just avoid anything with high alcohol contents. There's a few questions about price, which I don't anticipate the price going down in the next few years or so, but again, I can't really say for sure. You know, if our prices do change, that will reflect in our website for sure. There's a question here. Do you sell both capless and laser cap? I can't remember which one I have. No indication on the cap. We do not sell capless here, only laser cap. I'm just going to give a couple more minutes for some of these questions. Again, any of the ones I didn't answer, we will get back to. They're a little bit more specific and individualized. All right, so we're going to end the webinar now. Again, if there's any questions up here that I missed, we will reach out to you and get back to you for sure. But thank you for all attending.